Hi everyone, today we are doing a lifting thread treatment on this patient. We are using 18 gauge Arte 2 threads, and today we wanted to focus on the nasolabial fold area, and we also opted to do one thread down to her jowl. Obviously this patient does not yet have a jowl, we are just doing this as a preventative measure. And we are going to be doing a little bit of jawline filler on her in the future as well. So we're just doing that gel thread to prevent. So here I am just looking for my antegonial notch and marking that off. That's where our facial artery and facial vein come up. So I want to avoid that area. With lifting threads, there is no risk of vascular occlusion, but if you do, nick an artery or vein, they can end up with a very huge hematoma, which is obviously not preferred, so we are going to try our best not to bruise and give our patients hematomas. So when we're going in with lifting threads, it's very important that we are in the correct depth and we are not going too deep. If we are too deep, we're risking running into those vessels as well as nerves. So here with my 18 gauge needle, I am just making sure that I am in that correct plane right off the bat. This is going to make everything so much easier as we go through this treatment. When I go in with my cannula, I'm going to be able to pop right into that plane. And as long as I'm keeping my hand neutral and following that path, my cannula should glide very well right through that track. So in my syringe, I just have 2% Lido to just do some local anesthesia to that area, so it's a little bit more comfortable when we're going in with our threads. For my pilot hole, I like to use lidocaine with epi. This just helps with bleeding a little bit. Obviously the patient is still bleeding, but it just helps control that area. It just makes the procedure a little bit more clean. So here I am just going in and placing a thread of lidocaine in that track. I'm doing 2 vectors to her nasolabial fold because this is the area that we're focusing on, and I want to make sure that she's getting a good result. So what I kind of like to do is go through, place my threads. I'll sit the patient up with just one side done and kind of assess and see if I like the result that I'm getting. At that point, if I think that they could use another thread or two, I'll lay them back and we'll go ahead and place that. I don't like to do more than 4 threads per vector or per pilot hole, I guess I should say, just because the threads end up getting bunched up there and it's just a lot more difficult to get through that hole if you have a lot of threads in there. So if I did opt to do more threads, I would go ahead and I would make another entry point and just go down to that nasolabial fold again. But here I am just going down to my jowl vector. Like I said, she really doesn't have a jowl. We're just doing this as a preventative method just to build collagen in that area. So now I'm going in with my first thread. Like I said earlier, we are using Arte 2 18 gauge. This patient does have thinner skin. She's very petite, so I didn't want to go in with anything like too aggressive and risk having thread visibility. So we opted for the 18 gauge to still give her a good lift, but also just make sure that we're not able to see any of those threads. So that was my first vector, and then we're going to go in and do the same exact thing with our second, going in through that same pilot hole. I like to give it a little twist just to pop through that initial pilot hole. This is the same gauge cannula as the needle that we used, but still it's sometimes a little bit difficult to pop that blunt tip through that hole. But here we are just going down to our nasolabial fold again, and then we'll do one more to her jowl. Pulling that tissue back as I'm coming out, making sure that we are getting a nice lift and that all of those little barbs are engaging. When we clip our threads, we want to make sure we're as close to that insertion point as possible to make sure that we don't have any thread popping through that initial pilot hole. That just leaves risk for infection, and obviously the patient doesn't want any thread hanging out of their face. So pull them as tight as you can, give them a little pull back, and then go ahead and snip off that excess. Going down to our jowl here, we're going to just follow that same process. As you can see, I'm kind of tapping and just making sure that I like my depth before removing, and then we're going to go ahead and do the same thing. I cover my pilot holes just with a little Band-Aid prior to the patient leaving the office. They can take these Band-Aids off. that evening, I like them to keep them on the rest of the day just to make sure that we're keeping that area nice and clean and lowering our risk for any complication. So there's our Band-Aid, and we will see her back in about 3 weeks when her swelling goes down.